No provider likes asking their patients for money, but the truth is, your practice survival depends on it. If you ever felt uncomfortable asking your patients for payment, this video is for you. By the end, I'll show you a simple framework that removes the awkwardness and actually build trust with your patients. One of the most common problem practice owners face is avoidance cycle. That essentially means your staff skip holding conversations, patients get a surprise bill later on, and balance piles up, and then it leads to the mistrust issues. Patients feels blindsided when the bill pile up and shows up a weeks later. It really impacts your business where revenue gets lower, bad debts increase day over day, and staff morale drops down. This is just not about the money, it's about trust, transparency, and your practice stability. As a practice owner, it is essential for you to really understand what is the actual cause leading towards such issues that your practice is facing. You need to identify the root cause of it, really making sure what is the common practice, the procedures that you're currently managing and implementing into your business that are leading towards such issues related to staff avoiding having such conversations, leads to the mistrust, and then eventually your patients gets dissatisfied. So technically it's not a win-win situation. It's always alarming for any business like yours. While doing these root cause analysis, you really need to understand the patient's perspective, their mindset. Most of them really do not understand the deductible, the co-pays, or what's covered as part of their benefits. When they're unclear, they delay or avoid the payments. So once you really try to diagnose and understand the mindset of your patients, then you really get to know picture from the other side. When your patient do not understand some of those things, you really need to ask this question to yourself: what needs to be done to overcome this situation? Don't worry, I'll talk about some key steps, a framework that will help you come up with a practical solution to overcome issues like this. Now, let's try to decode the mindset of the provider. Doctors really worry about having conversation about the money and the collections, and they feel like if they talk about it, that will make them greedy or transactional. That's just a myth, trust me. Now let's try to understand the perspective of your staff. What is their take on it? Without scripts or a proper training, your staff just wings it, and every conversation sounds different. I have seen practices where 3 different staff members are providing 3 different explanations. What does that really mean? That essentially means they are not clear what needs to be communicated, how exactly these benefits explain about, what is the patient responsibility looks like. If they're unaware about it, even if they're aware about it and they're not consistent in their communication, then the patient walks away with more confusion. Now let's talk about a solution framework. Here is the structured approach that you can follow to overcome these hurdles in your practice and run your practice like a pro. First of all, set the expectations upfront. Give your patients a pre-visit estimate of the total cost that's going to be incurred as part of their visit, a procedure that you're going to be performed. So they should have fair understanding what this procedure is going to cost them. Now the real question is how to do that. I mean, how to educate your patients. As I mentioned earlier, once you have a proper script in place, your staff is going to be well trained, explaining about the details and educating your patients accordingly. Just to give you an example of a script that your front desk staff can use, explain to your patients proactively. Here is a short and a crisp example of a script that your staff can use to explain about the patient responsibility. According to your insurance benefits, this is $40, which is related to your co-payment, and considering your deductibles, about $120 is going to be your total billed amount. So once you frame your conversation in a scripted manner, you're absolutely clear about what needs to be explained, how it needs to be discussed, making sure why this is important for your patient to understand it. So this approach will help you just not making your staff more professional, but your patients understand it in a better way. It's really important to standardize the scripts for your staff in order to make sure your team is well trained on the scripts, they're ready to have meaningful conversations. I highly recommend practice owners to have role play training sessions with your staff members. So you really get to understand how your staff is behaving with your customers, what is their tone looks like, whether they feel confident about it, whether they're explaining the details the way it is supposed to be. Once you understand that your staff is pretty much at par and they are well equipped with the billing understanding, billing knowledge, and they are able to convey the message in a professional manner. So these role plays can help you significantly improving the skill set of your own staff members, as well as it's going to be an ease of mind for you because you understand your staff is well trained, handle your patient queries, and you really manage the patient care part. The next pillar in this framework is really leveraging the technology. In today's world, technology plays a very vital role. And if you're not leveraging these technologies and tools, that essentially means you're lagging behind. Now it's the time for you to really understand it and make a best use of it. For example, the card on file and digital payments reduce the friction between the staff and the patients. This method is widely used by most of the practice owners that not only help them collecting their accounts receivable in a faster manner, but also they do not feel any headache or loss in the revenue. Just think about Amazon. One click and done. Why can't a healthcare can be that much easier? It is certainly doable, it is practical, and it is compliant. You can really have a process in place, a payment integration systems in place where you store the secure card information, charge the payments, and of course you have to meet the compliance standards, which is not very complex, and this process can be easily implemented, and that will really reduce lots of stress and fatigue for your practice. Similarly, automated reminders plays a very important role to remind your patients about the outstanding balances, considering the fact they were already coached, explained about their patient responsibilities in terms of the money you have done that part correctly. Now, once you send them reminders either to the text, through the email, this will really help you to navigate and collect the payments pretty much fastly. When you send these reminders through the text or the email, make sure it is professional and non-emotional. So you can connect with your clients, your patients, without making them realize you're chasing it, you're pushing them to make the payments. It has to be done in a friendly and professional way. And this is something can be automated. No human interventions are required. There are many tools available that you can leverage and perform such tasks by simply drafting your email templates, your text templates, and through automation, you can nudge your patients about it and streamline your collection process. Being a practice owner, you really need to understand that collections is not about awkwardness, it's all about clarity. Your patients actually appreciate the transparency when it's done respectfully. A clear financial communication is just as much a part of patient-centered care as explaining a diagnosis. The way you explain the diagnosis, the way you explain the procedure to your patients, this is also very, very important for you and your staff to make them understand and realize how the payment system works, what their patient responsibilities looks like, what is covered by the insurance payers. Your patients will start feeling more comfortable while working with you. So if you want to increase your collections without stress, start with expectations, scripts, technology, and automation. DM me the word scripts and I will send you a copy of a sample script that you can use in your practice at your front desk. Train your employees to use it for effective communications with your patients.